Thank you, Cancórla. Minister, I have only time for a statement. I raised the issue with you a few weeks before Christmas, and that was the need for a separate minister or department or part of a department or a separate and unique voice in the overseeing of the rollout of the COVID vaccine. While my suggestion was not quite met with derision, nonetheless there was a strong sense of we know what we're doing. We don't need a separate department or section to deal with what I then described as the single most important piece of work that this government will undertake during its time in office. From a human perspective, our response from rolling out the vaccine matters more than anything. From a political perspective, it will be the benchmark by which this government is judged. As Minister for Health, you have a huge workload already. 12 months ago, nobody could have foreseen the unthinkable challenge that would be faced by our healthcare system. And for any one person to manage healthcare and to manage to be in charge of the vaccine rollout, in my view, it's not possible. What I'm saying is not personal and it's not political, it's practical. The putting in place of a national plan, the macro picture and the micromanagement that is needed, the detailed planning that helps to ensure confidence, buy-in and belief in the system. A few weeks ago, I mentioned Sligo University Hospital, where there has been real concern about those who got the vaccine, those who didn't, when they'll get it, and that's repeated throughout the country. A significant part of this problem is a lack of visibility of detailed planning and full transparency. People are on edge, really on edge, especially those in the front line. And any sense of unfairness, injustice, queue jumping feeds the sense that we're not in this together. And in my view, the only way to combat this is by appointing a chief vaccinating officer or other person who would be the face and voice of a vaccine rollout. Whether this is you or others take on board some of the responsibility, we desperately need a single face and voice to reassure people. Minister,
thanks,
the
Deputy.
old phrase, when the facts change, I change my mind. The facts have changed.
Thank you. Your time